I'm Jenna. I'm Dr. Silva's patient educator and coordinator. And if you're a patient of Dr. Silva's or you've approached our office, maybe you've talked to me. My job is to educate patients about orthobiologics and what Dr. Silva does here. And today I am becoming a patient again. I have apparently torn my meniscus. I injured myself on Tuesday. It is now Friday. I have not taken any anti-inflammatories purposefully so that my knee can actually heal, even though it's swollen and it hurts. Now, I want to ski in the future. I want to hike in the future. So I'm very interested in preserving my knee. So that is the attempt that we're making today. This is an acute injury. This is something that Dr. Silva tells me that if we attack it soon with bone marrow, then I will probably be back to normal in about 6-8 weeks. If we just leave it alone, I might have some longer term issues, maybe some scarring down. So because I have this access and because I want to preserve my knee, my choice is to do bone marrow, although I am really not excited about it. But I know that it is the best choice for the long term. So here we go. So we're gonna take a look at my meniscus tear under ultrasound, which Dr. Silva can see partially. I'm also gonna go get an MRI, but in the interest of time, we're gonna do stem cell therapy today.
Doesn't look too swollen. Looks like you're managing the inflammation pretty well.
It's less swollen than it was a couple days ago.
How's this outside joint area? Is that tender here?
It actually feels better than it did a couple days ago.
Wow, yeah, great. Any other tenderness anywhere else?
Nope.
All right, if I try to hyperextend the knee, any pain?
No.
Deep knee flexion, any pain?
No.
Your
That's where I start getting nervous.
Start a little nervous.
Yeah.
You're just gonna allow me to bend, and if
Okay.
it hurts, you can tell me.
Okay.
You can also tell me to stop if it's too uncomfortable.
Okay, that's where
There you go.
it hurts.
How
Yep.
about this?
Yep. Uncomfortable. Very uncomfortable.
Okay, so lateral meniscus and LCL is our primary target. Let's take a look at it.
Okay.
Okay, so it's not bad. See that? All right, so we're looking at the lateral meniscus here.
Mm-hmm.
As we scan it, you can see it's a little inflamed. It's slightly extruded from the joint line, which is not typical for you. You can in fact compare it to the other side
Yeah.
and see that meniscus is pretty well within the joint line. There's no fluid there.
Mm-hmm.
On the other hand here, we have some perimeniscus fluid, extrusion, and a hypoechoic defect looking like a tear. Looks like it's a superficial tear, so probable red zone, giving us a high likelihood of good success.
Okay. Red zone.
Red zone being more blood flow to that
Okay.
territory, and the deeper area being more the white zone, less blood flow. So more blood flow begets more healing.
Because that means more platelets and growth factors and stem cells can get into that area.
More oxygen, nutrition, all of the good things.
Okay.
Yeah, cellular access.
Okay.
And now let's look at your lateral collateral ligament. Attaches here. We can already see here at the distal attachment to the bone, it's a little enlarged, inflamed.
Mm-hmm.
If we scan it, it's kind of a band.
Mm-hmm.
The posterior structures don't really look all that inflamed or abnormal. It's more the anterior band of the LCL that looks a little sprained, but it doesn't look torn, so good prognosis here. Well, you know, if you had a meniscus tear and it was a chronic issue that had been occurring for many years, decades even, then we'd expect this meniscus to likely be a part of your pathology for the long run, meaning you have some lateral joint stress, some instability that contributes to meniscus tears. And while we can help it and treat it so it feels better and you can continue to remain functional, we wouldn't expect that tear to heal. So we commonly think they're as common as wrinkles as we age. So we just manage the pain and maintain function without surgery or cortisone.
Okay.
Ideally, right? Those things are appropriate in certain conditions, but in this situation, it wouldn't be right for you. We'll get an MRI and see what it says, but most likely, given the acute trauma, you were skiing and just bent it the wrong way, I would expect this to have a good outcome, a good return to function, because it's not brought on by chronic biomechanical dysfunction and distress. It was really just a one-time incident that I expect will heal up pretty well, but the best prognosis will be had after review MRI.
I'm nervous, guys.
You're gonna be great.
Big baby over here.
Yeah, me too.
So, commonly for this procedure, people don't need painkillers, they don't need sedation, just get numbed up locally by Dr. Silva here, which is what I'm about to do, and the aspiration begins. To do all the things that patients do.
Do you want to listen to something different, or is this okay?
How about Dua Lipa? Dr. Silva loves Dua Lipa.
Alexa, play Dua Lipa.
This is Dua Lipa from Spotify.
Oh my gosh, everyone's favorite. Please play the car song.
How are you doing?
So far, so good.
He thought we left him forever.
Yeah.
I wanted to.
Yeah.
One day.
We're just gonna let this know for a couple of minutes here.
Okay.
Set in nicely. Okay, you ready?
Yeah, so like, do you just kind of like poke me and make sure I'm numb, and then...
Yeah. You should be nice and numb, so we're gonna see how you do with that. All right,
Okay.
go ahead and take some deep breaths. Go to your happy place.
Woo!
We'll be
Okay.
done here in just a few minutes.
Back to your gondola ride.
I'm at the top of the mountain. Good.
Everything looks great. We're all done.
Oh, we're done?
Yeah.
Okay, that really wasn't that bad.
Yeah, you did great.
Okay.
Pressure here.
Actually pretty shocked. All right, so I made it through a bone marrow aspiration.
Congratulations.
Pretty
You're awesome.
uneventful. I feel a little bit lightheaded at the moment, so I'm probably just gonna hang out on the table for a minute,
Yeah.
but
Probably more nerves than anything.
I got really nervous. Well, it was pretty uneventful.
Wow.
Yeah.
It's getting tight because you're moving.
Oh, yeah. You're welcome. Thanks for giving me the Zofran before we started. I would have forgotten about that. Oh my God, you pulled a lot out of me.
You still have some.
I left it a little
It's
bit.
just, you know, it's funny looking at it myself, being like, oh, that came out of my body. Wow. Am I good on that?
Yeah.
All right. And now I'm going back to work.